Thank you for your time today, and on behalf of the whole Brisbane Aboriginal and Torres Strait Islander people and community, we'd like to present several topics we feel are important to guide you when you are developing your 2018 Health Services Strategic Plan. But first, in keeping with the spirit of reconciliation, we acknowledge the traditional owners of the land where this hospital now stands and recognise that these have always been a place of teaching, learning and healing. We have 5 people presenting today. Firstly, we have Katie discussing holistic care, and then my name's Kylie, will talk about the strengths of the Aboriginal community-controlled health services within that holistic care model. Lindsay will discuss intersectionality and the poorer health outcomes of Aboriginal and Torres Strait Islander people who identify as LGBTIQ. Holly will discuss the rates of discharge against medical advice amongst Indigenous Australians, which is significantly higher than other Australians. And finally, Jay Sheree will talk about the importance of patient advocacy to improve the health outcomes of Indigenous Australians.
The current mainstream health system in Australia is aimed at fulfilling the biomedical definition of health, which focuses on an individualistic perspective and does not consider community or spirituality as a factor. This varies from the definition of health for Aboriginal and Torres Strait Islander people, which is represented as a holistic concept of well-being, not simply an absence of illness. This definition is beginning to be included in some policies regarding Indigenous health. However, the holistic health needs of Indigenous people are still not being met. This is due to a number of barriers, which include a lack of equal access to primary healthcare and health infrastructure, poor implementation of appropriate policies into Indigenous communities, and a tendency for Indigenous people to not use mainstream primary healthcare, even where it is otherwise available and physically accessible. The majority of the current services available are not responsive to the cultural needs of Indigenous people, nor do they recognise the broader social determinants that impact upon their health outcomes. This is why it is so important to recognise that the Indigenous definition of health is different to the non-Indigenous definition, as different approaches to healthcare are required to address the varying health needs. In order to improve the health status of Indigenous people, their social, emotional, physical and cultural well-being need to be recognised, not just their physical needs.
Aboriginal community-controlled health services are services devoted to the primary health care of Aboriginal people. It is initiated and operated by the local Aboriginal community, addressing local issues and specific strategies relevant to that community, its culture and history, as just mentioned by Katie. Aboriginal communities operate over 150 of these services in urban, regional and remote Australia. The care model is more team-based than general practitioner focused, with over 4,000 staff employed and 55% of these identifying as Aboriginal and or Torres Strait Islander. The services not only focus on the health status of the individual, but also the socially determining factors of health for the individual and the whole community. Services include not only medical, dental, maternal care, chronic disease management, but also housing, aged care, emergency relief, training, foster care, cultural centres, and school readiness programs, just to name a few. Despite the restricted budget, as noted in my report, 51 to 61% of Australia's Aboriginal population annually visit these services, and studies have shown that they are valued by their Indigenous clients, that they have confidence in the service, and they achieve outcomes comparable to those of mainstream services. But compared to mainstream services, they do this with a more complex caseload, which is related to the holistic delivery model. There is also some evidence that when mainstream providers partner with these services, such as your own institution, it's beneficial in improving Indigenous access to care and patient outcomes. In conclusion, this model of care's focus on prevention, early intervention and comprehensive care has reduced barriers to healthcare while progressively improving individual health outcomes for Indigenous Australians.
Aboriginal and Torres Strait Islander peoples who identify as LGBTIQ, sister girls or brother boys, suffer even worse health than the already diminished health of Indigenous peoples. Sister girls and brother boys are transgender, born with physical genitalia that does not match with the way they feel and thus their actions. Those individuals who identify as such experience intersectional discrimination, intensifying poor health and well-being. These Indigenous peoples experience both homophobia or transphobia and racism that often deprive them of a sense of belonging, as they are often seen as ambiguous in a predominantly white, heterosexual society, and thus multiple layers of stigmas and discrimination are associated with who they are. The sense of social isolation from being part of both the cultural and gender minority often creates identity struggles, significantly affecting mental health and well-being, and resulting in high instances of anxiety, depression, self-harm, and suicide. The current focus in Indigenous gender health is sexual and reproductive health, but there are many more issues that are overlooked and unsupported when it comes to Indigenous LGBTIQ and transgender individuals, hindering their holistic well-being. Several programs aim to provide social and emotional support, including the National Social Media Network, Sister Girls and Brother Boys, and the organization Black Rainbow. We aim to implement more programs like these to provide further support for the mental and emotional health needs of these particularly vulnerable Indigenous peoples.
Discharge against medical advice is the occurrence of an inpatient in a healthcare facility that leaves the facility against the recommendation of health professionals. The occurrence of DARMA is reported as 10 times higher in Aboriginal and Torres Strait Islander people than non-Indigenous Australians. The reasons for DARMA is an under-researched area that needs to be better understood in order for change to be achieved. Reasons that have been identified in the literature fall into two categories: healthcare-related reasons and reasons outside of the health system. Reasons within the health system are reported to stem from a dissatisfaction within the system. Other reasons include cultural barriers and miscommunication, which reportedly leaves a high percentage of Indigenous patients with little understanding for their admission. Reasons outside of the healthcare system include drug and alcohol dependency, unexpected admissions, and family support. Change needs to occur to reduce the rates of DARMA in Indigenous Australians. A strategy that has reported positive change is the implementation of Aboriginal liaison officers and Aboriginal healthcare workers. Evidence has shown that liaison officers enhance cultural safety in hospitals, therefore reducing the risk factor for DARMA. However, while this strategy has proven to have positive results, it is not being utilised appropriately, with a disproportionate amount of staff being Indigenous. Further change needs to extend outside of the healthcare facility, and there needs to be more coordination between hospitals and community facilities in order to reduce risk factors for DARMA.
Patient advocacy can be described in terms of specific roles of nurses, such as helping the patient to obtain required health care, assuring quality of care, defending the patient rights, and serving as a liaison between the patient and the healthcare system. It is an ethic of nursing practice. Nursing advocacy implies that differing interests, equal care should be given in proportion to the importance for the welfare. As a result of colonization, Aboriginal and Torres Strait Islanders people are not getting proper health services. Nurses are well placed to work across organizational and professional boundaries to deliver person-centered care and a holistic approach to population health and well-being. As being a nurse, she has a vital role in improving the health and well-being of Aboriginal people. Nurses should not have any kind of prejudice and racism and should accept cultural diversity. Though through health promotion strategies including culturally safe practices, nurses can significantly contribute to improving the current health status of Aboriginals. Delivering culturally safe practices can challenge preventing inequality of healthcare. Thus, providing holistic care with cultural safety, nurses can become better advocates for Aboriginal and Torres Islanders people. Thank you once again for your time today.